So word on the street, LaShawn, is that there is some kind of certification or credential out there that can finally put all the questions and concerns about what a public health professional is, what they can do, to rest. The end all, be all of all certifications.
Damn.
Would you believe me if I said that?
I wouldn't believe you for a second.
You don't believe that all these core competencies that we say public health professionals should be good at, that there's an exam out there that can actually test you, me, others, to see if we can put our money where our mouth is?
I'd love to learn more. Tell
Right?
me about it.
Right? Certification that we talk about epidemiology, biostatistics, research methods, program planning, evaluation, and all these different things. Everybody's a public health practitioner. Everybody's a public health professional. But are you a CPH? You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
That's a good intro.
It's a good intro, but it's not a rhetorical question, are you?
I'm a CPH, but are you?
Oh, you're a CPH now, aren't you? Since when, man?
Okay. Couple days ago, couple weeks ago.
Wow.
I don't remember.
So ordinarily, I would ask you why you do certain things, but I think you're just a bit of a free spirit in that sense, where you challenge yourself to do a variety of different certifications and credentials. And I think for the last 4 years or so, you probably have done one every year at least, or you've challenged yourself to do at least one every year. So I think you probably hit your quota for 2024, hopefully.
You're kind of right. You're not too off.
Yeah, I think you've pretty much every year you've done something.
Yeah. I try to keep up to date with things.
Now, in the previous episode, we talked about standardized testing for public health professionals in general, more or less. And then now we're going to talk about a specific one from the National Board of Public Health Examiners. They administer this certified in public health exam that allows you to become a certified in public health professional and have that CPH credential to the right side of your name. LaShawn now has it. Congratulations.
Thank you.
For people who want to explore this, whether it's through the great persuasive arguments we made for pursuing some kind of standardized credential, or something that they've been thinking about for a while, usually the first place to start when we meet with people too who might have questions for us is like, what do I need to do to even be considered for that exam? So eligibility requirements. I'm assuming because you and I went through a Master's of Public Health program that we are eligible to write it, but I'm not sure if there's years of experience that are required. We talked about the CEF accreditation. Is that a part of it? How long do you have to work? Does it matter where you work? We're all confused. Shed some light on that.
So before we even start talking about what the actual exam entailed, let's see if you're eligible, right? So there are 4 eligibility criterias that are indicated on the website. The first one is being an alumni of a CEF accredited school or public health program. And so, for example, when you're applying for a master's or doctoral degree in public health, usually in the US, some in Canada, they're often branded as CEF accredited schools, which is certified, what is it?
The Council
on Education in Public Health. And they basically are standards and curriculum that these schools have to follow in order for that school to be designated CEEF accredited. And usually there's some course requirements there, there's a practicum component there, and there's some sort of capstone project piece that's usually indicative of a CEEF accredited program. And there are a bunch of other kind of standards that these public health programs need to adhere to, including a bunch of reporting and monitoring and evaluation. But so if you're a student from one of those schools, you are eligible while you're in that program to be provisionally certified. Or if you're alumni of those programs, you will also be eligible to write the exam.
So it must be graduate level or above. So I guess if I was at a CEEF accredited school in an undergrad program, am I in the same boat, or do I need to be graduate level or above?
That's a great question, actually. So I'm not sure. But there might be, as long as your program, regardless of graduate level or whatever, as long as it's mentioned that it's CEEF accredited, you should be good to go. Usually it's master or doctoral level programs. So again, you could be students of the program, you could be alumni of the program. Those are two of the eligible options. Or if you're public health faculty with at least 3 years of teaching experience and working in public health experience, you can also write the exam. And the final eligibility criteria is if you have public health work experience. So this is where your point comes through. A bachelor's degree in any concentration and at least 5 years of public health work experience, a relevant graduate degree in at least 3 years of public health work experience. If you fall into one of those areas, you would be eligible to write the exam.
So it seems like a broad range there to capture a variety of different scenarios that someone might get educated in and have experience through.
Yeah.
Especially that last pathway where it doesn't even have to be a public health related bachelor's degree, but they expect that for you to be eligible, you would need 5 years of work experience, which is fairly common. I would say there's a lot of people that have various bachelor's degrees who work in public health. So that's pretty cool.
Yeah.
Now, after assessing the eligibility criteria, someone might be influenced to pursue the exam. You mentioned that it's something that you could think about while you're in school. It's something that you could think about when you're an alumni of a program, recent graduate, something you could think about when you're already in the workforce. Now, what does it entail in terms of the exam? Because speaking about myself in particular, that's a big part in my decision making on whether I pursue something, the level of effort it might require, just kind of understanding how am I going to be tested essentially? Like what components make up the exam? And I imagine they have some kind of, I don't know, if rubric or curriculum that they want to cover off. What does that look like?
Yeah, so they do cover 10 domains in the CPH exam. So you're going to be tested on each of these 10 domains.
That's a lot.
Yeah, there's a lot. It's communication, leadership, law and ethics, disease prevention and injury reduction, community engagement and partnership, program planning and evaluation, program and resource management, policy and advocacy, health equity and social justice, and data analysis and informatics.
That's a lot, man.
It's a lot that we already talk about, right? When you talked about competencies, a lot of those pieces kind of align.
Smokes.
But yeah, there's kind of a lot of areas, and you might be wondering, where the heck did they get these different domain areas from? Well, every 5 to 7 years, the NBPHE, which is the, what is it again, Gordon?
National Board for Public Health Examiners.
The National Board of Public Health Examiners, they basically conduct a job task analysis every 5 to 6 years. And basically what that means is it's like a carefully constructed survey used to determine the body of knowledge in a professional area. So in this case, public health, to ensure that people are performing their jobs in a competent manner. And it's an industry accepted process that really defines the knowledge, skills, and attitudes needed to perform a job. And it's used to create different training protocols and educational curricula like the Certified in Public Health certification. So through this kind of jobs task analysis that was conducted, the recent version of the CPH exams content was updated. It didn't change too much from the years prior. They just kind of updated different category names and changed a bit of the weighting of each of those categories. I mentioned the 10. They used to be more of an even spread of the 10, but now they're testing them in different proportions across the exam, which is going to be indicative of the number of questions for each of those domain. But for all intent and purposes, pretty similar based on the recent job task analysis. Now, you might be wondering, like I saw Gordon's face, there's a lot of different domain areas. In fact, the actual exam itself is going to be 200 multiple choice questions, and you will be given 4 hours to complete this exam. And this exam can be written in person at an approved test facility or proctored remotely. So someone's actually watching you write the test virtually.
I feel like I need to take a nap after all that, LaShawn. That sounded a bit hectic, to be honest.
So it's actually really interesting though, because going in, like, of course, I spent some time working in public health now. Going in, looking at the different content areas, there's a full list of detailed public health. What's the word? There's a full kind of breakdown of each of the domains tested on the CPH exam, and there's kind of like subdomains, if you will, about what specific areas within the domain are going to be tested.
Oh, wow.
And going through all 10 of these domains really made me reflect on being a public health professional and thinking about how much I've forgotten over the years in certain areas, like, for example, biostatistics and different elements of policy and advocacy and different elements of public health biology, some of those basic concepts that you forget and you just kind of refresh yourself. So you're reminded of that breadth and scope of public health in a different way. Do you remember the 2x2 tables, incident rates? We're talking about odds ratios, for example.
Yeah.
You remember calculating those in the different formulas? Well, you're going to have to know that for the CPH exam. And
Case study, homies.
Yep, and you're also going to understand the different research methodologies that are used, the different statistical tests that are used in public health and in epidemiology and biostatistics. So again, if you don't do this in your formal line of work on a day-to-day basis, you might be forgetting some of these ideas and concepts.
Yeah, for sure.
So the fact that there's this exam and credential available that can continually advance and refresh you on different pieces in public health, that was an interesting takeaway for me. Just the whole bit about things that I forgot and things you remember, and thinking about how you could use some of these pieces that you're relearning and implement them into your everyday practice.
I haven't prepared for the CPH, full disclosure, but even just like refreshing on specific things, like for me, like in different areas that I'm interested in, you realize that you probably forgot or lost touch of so many things. You realize how much you actually learned when you go back to like refresh yourself and realize how much you forgot. That was my experience, like in a smaller degree, looking back at some of the courses that we took and the concepts that we learned. Like, man, we really learned a lot. It just was too much at the time and maybe not relevant because we're not working. But now you're working and like, I could have used a lot of these things. Right? So that's kind of cool that you experience it like that.
Yeah, and then you kind of, depending on how your career goes, you're taking on different jobs, different responsibilities, and you might touch on some of these domains more than others. I know, for example, in my current role, I'm spending a lot of time doing program and resource management, for example. You're doing program planning and evaluation, the community engagement and partnership pieces. So those are kind of more of a focus of what I would be doing for a current job, but you could very much appreciate how all these areas intersect and are mutually reinforcing to your ability of being a very competent public health professional and practitioner.
How long did this take you to prepare for it? Because you touched on how the 10 domains have subdomains under there that they basically recommend that will be on the exam. Is there a body of knowledge book or courses that you took? How did you get ready for it? And how long was that process?
Yeah, I would say the first place you should go just to kind of start thinking about some of this material is the CPH exam outline, which lists all those subdomain areas just to kind of see the breadth of what you're actually getting into. There's so many kind of sub areas as well. Like, for example, under the data analytics and informatics piece, it's interpret mortality, morbidity, prevalence, incidence, and risk data. If that sounds like a foreign concept to you, maybe that's the area you focus more on in the initial studying. Beyond that kind of outline, there are no formal materials that are going to help you. It's not like the project management professional certification, PMP certification, where they have this thing called a PMBOK or PMBOK, which is the project management body of knowledge, where you read that and it has all the information you need. Instead, you can draw from a bunch of different sources. The NBPHE recommend some resources. So they actually have a couple of practice exams that you could kind of just take and assess your current state of public health knowledge. They also have links to different organizations that have created resources for this. So it's like a paid resource where they cover the different 10 domains on the exam. They also, which is very handy, is the webinars. They have monthly webinars, or not monthly webinars. They have webinars for each of the topic areas, and I think they have specific webinars every year that cover each of those 10 domains. So all in all, when I was going through my studying process, I focused on those practice exams. I focused on the webinars that they had. Just, it's interesting when I study and I kind of go through some of these sub areas and domains. If there's a particular area, I'm like, well, what's this again? It leads me to Googling something, and that leads me down a whole path of just kind of learning. So that happened a lot, which kind of helped bridge different pieces together as I was going through this. But as tempting as it is to look at all of this in isolation, the 10 different domains, for me, even though it doesn't necessarily say this anywhere, it's about connecting all 10 of these domain areas in a way that helps you become a better public health professional. So what am I talking about? As I'm thinking about being a leader, which is also one of the domains in this exam, as a leader, what are you doing? Well, you're communicating. There's a domain for communication. You're working with other partners. Well, cool. There's actually a domain on community engagement and partnership. You're talking about program and resource management. That's what I do. Underlying all of these things, and where we're talking about the socio-ecological model in public health, what is one of those main ways or concentric circles that are most effective in a lot of different ways? Policy and advocacy. How are those connecting to the things that you're doing in your work? Underlying public health, what are we ultimately doing? We're talking about health equity and social justice, right? When we're talking about specific diseases and different measures of diseases, how are we using that as evidence base to inform our decision making across all these different domains? When we're talking about public health biology and different infectious disease outbreaks, how are we bringing all those information and bits and pieces together to make these decisions in public health, right? So that's how I'm looking at it. I know it's very easy and tempting to look at this in isolation, but as you're kind of taking a step back and thinking about, okay, what are these domains and why and how are these intersecting in the ways that they do? I think it allows you to take away something else from it.
It sounds like you are uniquely positioned, having worked in public health for several years, to appreciate the exam preparation and how to go about it versus, I know I had recommended that this should be a part of all MPH programs for graduating, but I think there's a different level of appreciation that comes when you're in the field and you use it as like a reflective tool versus like, one more exam I need to pass to graduate. I think it's a different ball game.
For sure.
Now, so it sounds like you didn't buy a course, like a video course, and go through that. You kind of used the exam outline tool and kind of brushed up on things that you were a little bit unclear about. That was your approach? Yeah.
Yeah, and to answer your question about how long it took, it very much depends on the person, right? Someone who's less familiar with the domain areas are going to take a longer time, right? Naturally, right? And for me, going through the webinars, I think it's like 2 hours each, for example, for each domain, going through some of the practice questions and just spending that time reflecting and thinking about how these different pieces fit together. I would say a month is for most people, month or two, depending on how you want to go about it. And for me, it wasn't every day I would finish work and just go and got to study for the CPH exam. It was like taking it maybe 2 hours, 1 hour a day type thing over a longer period of time rather than just going all in. Yeah, it very much depends on how you prefer to study and your processes. But one thing I will mention is that given this is a national exam in the US or a national organization in the US and based in the US, there are many US specific questions and examples that are given. So for me, wanting to learn more about the US public health system, it was also a perfect opportunity to learn more about that and apply it in different ways that I haven't previously. Like I'm used to applying public health concepts in Canada and in a global setting generally. And obviously within the global setting, there's specific communities that you kind of work with and think about how you apply those concepts. But in terms of a specific country, wanting to understand how they function, how they're funded, how they're structured, those are some of the things that also come out of that. What are the different policies? The EPA, the Environmental Protection Agency, they have created different policies in the interest of the public. How are those policies affecting public health? How are they protecting communities? How is the way public health is structured and funded in the US? Why is that important? And how does that function? And how does that structure influence its actual function on the ground?
And that's context that if you didn't really prepare for that and you're from a different country, you wouldn't really be as connected to that.
So there is a lot of kind of learning that US context, which for me was one of the reasons why I did it. And I was interested in that.
Now, I would regard you as a pretty smart guy, someone who is a good exam tester, right? Someone who likes to learn and study and develop your skills, get more educated. You're someone who's been working in public health for a number of years now as well. So the exam was easy breezy, right?
I wouldn't say so. So like I mentioned, there's so many different areas that I was refreshing myself on. And these 2x2 tables, for example, you just need to wrap your head around that in a different way. I would say it was not easy, but doable. Definitely doable. A lot of the questions that you're given from these domain areas, you might be very familiar with it just based on your public health experience. Like if they're giving you a question on program management and you're managing a team and something goes wrong, like you probably have a decent idea of how you're going to approach that question or that scenario. But when it comes to like specifics, like research methodology, and there's a research study going on and which is the best methodology to use given this certain context, that might be more foreign to people. So just the breadth of the exam in these 10 different areas might be daunting and it makes it more challenging. It's not a walk in the park by any means. I think it just requires time to learn the material and then write the exam. I wouldn't just go into it without studying. If that's
you wouldn't wake up out of bed and just go for it kind of thing.
Yeah, I wouldn't do that. It wouldn't be smart. And there is a cost to this exam. So I wouldn't want to put myself in a situation where I'm not passing the exam and getting the credential. I want to make sure I get the credential for the exam that I'm practicing for and prepping for. So, yeah, I wouldn't say it's easy, but I would say it's doable.
Do they disclose what you need to quote unquote pass? Is
They don't
is that out there?
Yeah, they don't explicitly mention like a passing score. I think I read some stats that good majority of public health professionals who write the exam actually pass. So I think it has like a 70 plus pass rate, which is quite high, I would say. But yeah, like once you finish the exam, you do get like a raw score, and they're actually changing that to more of a scaled score, similar to MCAT, where you remember those, how those look?
No, I don't want to.
I don't want to talk about it. So now it's a more scaled score instead of raw score, so you could kind of better compare across different exams. When you had the raw numbers, you couldn't really compare it across different test takers across different exams. But now that it's scaled, it's a better indication of how you do relative to other people on different days. Yeah, exactly. So once you're eligible to write the exam, when you actually want to write the exam and apply to be a candidate for this exam, the registration costs $385 USD. And in addition to that, it has to be approved. So you have to fall in one of those 4 criterias and have proof of that via resume, via your status of your degree, etc., in order to get approved.
Like
yeah, not necessarily references.
Okay.
They might, but that's only if they have any questions. But generally, they'll look at through your documentation and your application and determine if this person is approved to write the exam. Once you get approved to write the exam, you'll get options to schedule the exam either in person or online, and you go forward from there. The other thing I do want to mention is every 2 years, there's a recertification process. And this is the part of the certification that is really important. It's not my name is LaShawn, I wrote this exam, I'm done forever. No. As we know in public health, everything is advancing. Well, sometimes maybe not as much as we'd like, but things are evolving, things are changing. And in order to kind of keep pace and show your commitment to public health, it's important that we have continuous learning as a part of our professional development. And that's why every 2 years there's a recertification process where you're going to have to essentially complete around 30 credits or hours worth of learning to fill that requirement. And this could be through reading an article, listening to a podcast, attending a webinar, taking a course. It's very kind of, there's so many different ways to fill those requirements. And for someone like Gordon, who's an avid podcaster, can definitely complete those certification credits pretty quickly. And if you already engaged in some of that professional development stuff, it's pretty straightforward. They do have a list of resources and free activities that you could look at and learn and use those as your credits. And then it costs around $95 every 2 years to recertify. So I just wanted to point that out there. It is a cost. And it's part of the
it's not
process.
unusual. Just like any licensing component for any profession, there's always a cost to take a test and renew membership. So that's not unusual at all.
Yeah.
As you could see, LaShawn did the CPH exam. He passed it. He's very happy about that.
Am I?
And I think you are. And
I'm joking.
I think this is the first time that we've talking about it in depth, because I wanted to save the chat for the podcast where I could learn about it as much as the audience listening along to see how things went. So I would say I'm not quite there yet in terms of wanting to pursue this, but there's some really interesting domains that you pointed out there that I've flagged in my development that I want to get better at. So, maybe an exam's a good way to put my money where my mouth is too.
Yep.
Why not? Anyways, this was Gordon and LaShawn talking about the CPH exam. Signing off. Until next time.
Peace.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.